Hello, welcome back to the show. And today we're really excited to have Dr. Elizabeth Davidson joining us. Dr. Elizabeth and I connected on Facebook a few months ago now, I think, and I just found your journey and your story was really something that I thought our audience would enjoy. So thank you so much for being on with us today.
Thanks so much for having me. I'm excited to be here.
Awesome. Can you share with us a little of your early experiences with chronic migraines and joint pain and how that shaped your childhood?
Yeah, so I started getting migraines when I was 4 and then joint pain when I was 7. Like the summer I was 7, I wasn't allowed to walk. It was so bad, which was the first year my town had a playground, and that was really, really hard. So yeah, growing up sick was challenging. I missed like 40 days of school a year. It was really hard to have friends and have a social life and just be a part of any sort of life. But it really also gave me a chance to think pretty deeply about life in a lot of ways. And I recognized really young that whenever I took one of the medications that was prescribed to me, I felt worse. And so I started refusing to take medications when I was 10. And that shifted me into searching for other solutions and trying different things and basically experimenting on myself since I was 10 years old and working toward ways to be healthy from the ground up rather than looking at a symptom and trying to get rid of that, shifting so that I was focusing on making myself healthier all the time.
It's
And
amazing. Just like usually when we're younger, we're really more connected and more intuitive. And it's fantastic that you were able to take that intuition and actually use it to steer you in the right direction for your body and your healing
yeah.
journey. Was there anything specific around that made you go in a certain direction, or were there any certain challenges around achieving that at that time?
I mean,
Loaded
just,
question.
I mean, making myself even more different from everyone else,
Mhm.
like being a kid. I don't know if you two have kids, but they tend to love sugar and candy and video games and all of that kind of stuff. The video games were kind of just starting when I was a kid, but none of those things are very health promoting. And so they
Mhm.
weren't things that I could really interact with. And I also had to be really careful about what I did do. I had to plan out my activities like priority wise. Like I've always loved to ski, but it was pretty much the only activity that I could do because I was most motivated to do that. But it took other things off the table. Like I wasn't able to like go to parties
Mhm.
because I wouldn't be able to function the next day if I did. So,
Crazy.
just finding my way and being outside the box from such a young age, it's hard to integrate into society that way because just being so outside of things. But I think it's all worked out pretty well.
Yeah, definitely. And the experiences that we have shape us for the future as well, right?
Yeah.
And
Yeah.
was there, I mean, 10 years old, we both read that and it was like, I can't imagine going to my parents at 10 years old and saying, I'm not taking medication anymore, or I want to look for a different route. What was that journey like?
Well, I'm really stubborn and but also very logical. So when I gave them, well, my dad wasn't all that involved, but when I gave my mom my reasons,
Hmm.
there was really nothing she could argue with,
Mhm.
you know, like these keep making me feel worse. They're obviously not working because I'm still sick all the time and I'm just getting worse and worse. And at that point, when I stopped, I was starting to have skin problems and digestive problems because I took lots and lots of antibiotics and all of that. And, and my mom, she is a little more holistically minded than other moms of that era. Like she baked all our own bread and goodies and stuff like that. And we didn't have lawns, we had gardens. And so, she tried to feed us really well, but still went with the medical model a lot, mostly out of fear, whenever I was sick. But she could also listen to me and like, okay, that makes sense. So I remember like one of the first things I did was like I stopped eating sugar when I was 10 because what if I try this? So I started doing elimination diets basically. Like I tried one after another. I didn't know that's what they were called, but it just made sense to me that whatever I was eating would have an effect on my health. And so, she let me get away with that kind of stuff.
It's
Yeah.
pretty neat to hear because like a lot of people kind of go through that process, but not at 10. You're going through that process at 10 and figuring out your body so much earlier than, because like I know Kate and I have been through that as well. We've done the elimination diets and cutting out basically a lot of the processed stuff. But for you
Mhm.
at 10 to be having that realization and having the means, and your mom was who was supporting you through that, it's pretty remarkable.
It's amazing.
Had
I
to be
did that and I was
done.
like 28. I wish I would have done it at 10.
How many years ahead of people were you because of starting at 10 and like, okay, this needs to happen?
Very
I
cool.
guess a bunch, but at that point too, I was just so sick. Like I didn't think I was gonna live much longer.
Hmm.
I was desperate. Like I didn't know what else to do. I had to do something. I've always been pretty good at taking charge of my life.
Hmm.
And, my parents were pretty distracted. I have two younger siblings who were menaces. And so I was always more just solo and thinking about how to do things in a better way. And yeah, I wanted to keep living and I wanted to keep being able to ski and do fun things. So
Based on your personal experience, how did that transform into what you're doing with your life now and helping other people do the same thing?
yeah, well, started experimenting with making my health better when I was 10 and I never stopped. so I've tried, like, you name it, I've probably tried it
Hmm.
and monitored the effects of whatever therapy, whether it was acupuncture or Chinese herbs or chiropractic or, the elimination diets or any diet. Like I've been vegetarian, I've been vegan, I've been keto, I've been carnivore, I've been grain free, you name it, I've done it. And so have gained a lot of wisdom. And I started
Hmm.
studying nutrition, at 10. So that to have been involved in nutrition for that long is a big thing. So it inspired me to just keep searching. And so then I got my doctorate in my mid 20s, or started my doctorate in my mid 20s, got
Wow.
that before I was 30, and just got to learn so much about how the body works and how unique we all are. That
Hmm.
was one of my biggest takeaways. Like, in anatomy lab, we had 15 bodies to dissect, and then we had a textbook and we had to learn the textbook, right? But then
Hmm.
we go dissect people and none of the bodies were like each other and none of them were like the textbook. It's like, oh, isn't this interesting? We're all completely different. And so it really taught me to, like, as a clinician, to listen deeply, because I find it so baffling when, like, people come to me after going to lots and lots of other doctors and stuff, and their doctors tell them, like, they'll go tell their doctors what's going on with them and their doctor's like, well, I don't think you're right about that, or no, this is what's happening. And then they believe them, and I'm like, no, 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 you live in your body 24/7. You
Hmm.
know
Yeah.
it better than anyone. Your innate wisdom is 100%, and listen to that, because it's the truth. Like, that's one of our deepest truths, is what we know about ourselves. We know ourselves better than anyone else does. So really just made me recognize that on a huge level, on a universal level. Anyone I talk to, I'm like, you're the expert. I'm not. Like,
Amazing.
you're the expert on you. Because yeah, we're all completely different.
That's so awesome. It's such a powerful thing to think about as well,
Hmm.
right? Because there's a lot of the white coat syndrome of thinking. I mean, I grew up in a family that was like, if there's something wrong with you, you go to the doctor, you don't dispute anything, you don't argue with them, you just do what they say. And that didn't work for me either. Medicine was not a good solution. And so,
Yeah.
yeah, that's really powerful. I heard something recently about how doctors don't know what to do when the person in front of them doesn't match the textbook. It's such a deep thing because it's like all of a sudden, oh, there's something wrong with you because I can't figure out why you're having these symptoms. Can you talk a little bit about the diagnosis myth and like what that means and how it can help people to understand?
Yeah. So diagnosis is, it doesn't really mean anything. Like, I remember when I got diagnosed with fibromyalgia and I went in and I was like, so all my muscles hurt, all my joints hurt, like they hurt pretty much all the time. I'm tired all the time. And they said I had fibromyalgia, and fibromyalgia translates to fibro is fiber, myo is muscle, algia is pain. So I went in and told them I had pain on my muscles, and then they told it to me in Latin. And if you look at any diagnosis, that's what they do. And one of the big problems I have with diagnosis, it's people accept it like it's a gift. Like they want to know what's wrong so they can own what's wrong.
Yep.
And it really doesn't mean anything. It's just a name for a set of symptoms. And symptoms are so valuable because they're your body's communication. Like it's your body talking to you. And the diagnosis doesn't give you a why for those symptoms. It just puts a name on them. And mostly those names are just used to match them up with medication. And medications always make your system sicker. Always. I mean, they may be useful in the short term, but they always put more stress on your system. And so they change your biochemistry, which your biochemistry is who you are. And so when you change that, then you don't even know who you are anymore. So a diagnosis, it feels like it's such a power move from the medical system. And it really takes our individual power away. Because our individual power, when it comes to our health, it is in the symptoms. Like our symptoms tell us what's going on and what to look for. And so when I hear about someone's symptoms, I'm like, oh, goody, let's dig deep and figure out why that's happening. Like, what is your body saying to you? Where's your body like missing something or out of balance, or what do we need to fix so that symptom can resolve because you don't need it anymore. Mm-hmm. So it's just a different perspective looking at the why rather than the what. Mm-hmm. And I feel like it just gives so much more information and so much more flexibility to really dig deep and figure out how to really align someone with their health and well-being, and in a way that they can live, rather than just, oh, you have to take this medication forever, or oh, it's all in your head, or we don't really know what's going on. You probably have anxiety. Here's a medication for that. Yeah. So
it's crazy.
Answer the diagnosis question. I could go on about it.
It did. It's crazy too, because I remember getting a diagnosis because I was diagnosed with MS, and it was just like, here you go.
Yeah.
Bye.
Like they're giving you the best Christmas gift.
And no solution.
Right.
Like, okay, what do I do with this? No one's telling you that. It's just like, oh, okay, you have this thing now. So, go to the specialist, go to the MS clinic. And like you said, they put you on some medication. And it's like, yeah, but you won't get better with that route. And it does take away personal power. And that's one of the biggest challenges that I've seen with, I went through years of being in support groups and just looking around and realizing no one's getting better in here. They're all taking the medication. They've owned this label that's been given to them by the doctor. And you can wear it like a badge of honor because you do benefit from it in some ways, right? There's not in health ways, but there is attention and there's community, and it's like coming to terms with realizing I am not getting healthier. I need to do something different. So yeah, I love what you shared about the diagnosis myth, because it's true. It's not a solution. It's a label, and that's not solving anything.
And I personally know people who have recovered from pretty much any diagnosis you can name. Like I know several who've recovered from multiple sclerosis, even though, it looks like maybe you're one of them, even though you're told that it's degenerative and you're going to have it forever and it'll eventually kill you.
Yeah.
But it's just not true, because it's proven to be not true. I know the people so, and our bodies are so amazing. Like, I don't know. Do either of you have children?
No.
Okay. Well, I do. I have one, and a lot of women do. But we all have that ability to build a person. You could create a whole person. So multiple sclerosis, on the other hand, that seems pretty easy
in comparison.
And it's not just that. That's just one, I think, the most amazing things that our body can do. But also, like, if you ate breakfast today, your body just broke that down and took all the nutrients and put them where they needed to go, and got rid of the stuff it didn't need and gave you the energy that you needed from that. And it does that all the time, like constantly. And it's doing amazing things all the time. So why wouldn't it be able to heal anything. Truly think we can heal anything.
And that it does that naturally as well. Like if you cut your finger, your body knows what to do for that.
Yeah,
So why not other things?
exactly.
Yeah.
Yeah, we see the proof all the time.
Hmm.
I think we're so used to how amazing our bodies are that we forget how amazing they are, you know?
True. We need the reminder.
Yeah. So I try to remind people a lot.
Perfect. With what you already said about essentially validating for your clients that they are able to heal and listening to their body, because
Mhm.
we're told all over the place not to listen, to follow the doctor's advice. So beyond telling your clients that you can heal, you know your body best. How else do you build confidence for them in their health journey? Or is that the biggest thing that you do offer?
I mean, that's a huge piece. I love reintroducing people to their intuition because we all are intuitive and it goes kind of hand in hand with knowing your body best. But
Mhm.
like, have you ever had a gut feeling?
No, for sure.
Yeah.
Yeah.
So that's your intuition talking. Have you ever not followed your gut feeling?
Who
Yep.
hasn't? How did that go?
It did not go well, did
Yeah.
it? Because it went against your intuition. Again, it went against what you know on a foundational level.
Mhm.
So I do teach some about that. But I also one of the big things that I do for people is I read their blood work from a
Mhm.
functional perspective. So most people have chronic illness when they get their blood work done, they're like, oh, it's all normal. But what, it just doesn't mean anything because normal ranges are
Like,
the average of all the people who have come in, and they're
yeah.
huge. They're not normal for, say,
Mhm.
like a 35-year-old woman who's had 2 kids and has been tired for the past 15 years.
Mhm.
Like, what is normal for that?
And as
it's
you said, it's
not.
different.
Yeah, we're all different and we're all in different phases in our lives, and normal is different for all of us. So when I look at blood work, I look at it from a functional perspective. So I want to see where someone feels good
Mhm.
and the relationships between the numbers and what the numbers actually mean. Because you can look at like a bunch of white blood cell numbers, for example, you're like, oh yeah, that's normal. But if you look a little deeper and look at the different types of the white blood cells and the ratios between them and all of that, you can find so much information. And it's like that through all of the regular blood work, like the complete blood count, the metabolic panel, all that. There's so much information that just gets glossed over. So one of the things I do is I show people how to look at that, how to read it themselves so they can have that knowledge and see it for themselves and see what's changed over the years for them too. It's really interesting to like match up blood work with like like from years past with how they're feeling at those times. Like I've had some people who keep really good journals of stuff and I've gone back through years of blood work and they're like, oh, so at this point, looks like you had a parasitic infection. How are you feeling? And they have, it's just fascinating. So I feel like teaching people what that actually means, it just gives them a lot more power when it comes to, that big scary medical thing.
Mhm.
If you bring it down to like a level where people can just see it and be like, oh, this means that my neutrophils are high right now, so that means I probably have an overgrowth of bacteria. Let's see what we can do about that. And when you can look at it and know, it's like teach them the language of it. It's all because it's all in a different language, and once you understand the language, it's really pretty simple, and it's just empowers people to have more of a grasp on what's going on rather than go in and look at whoever's reading that as the expert and them telling them. And that's just one example. Like I like to do that with any kind of tests or whatever they have. I want to help them understand what it really means and learn it if they want to learn it so that they'll have that forever.
Mhm.
Amazing. We're gonna have to call this episode Personal Power. We've talked about so
Yeah,
many
no kidding.
ways that we can take our own personal power back and how a practitioner can help you do that as well. What are some common misconceptions that your patients come to you with, and how do you address those?
I mean, probably the biggest thing is that they're going to have whatever they have forever, like, especially when it comes to an autoimmune diagnosis. Like, whenever that autoimmune label gets put on there, I feel like it's extra scary for people.
Mhm.
Mhm.
Um, yeah, they're just, as they're told, that they're going to always have it. And I think they come in thinking it's more complicated than it is too, because when you put all those big labels on things, it sounds more complicated.
Mm-hmm.
But when I explain to people, well, I guess the other big piece of that is that they come in thinking that their body's doing something wrong.
Yep.
And I don't ever think anyone's body is doing something wrong, even when it's got an autoimmune thing going on. Like, okay, your immune system is working so hard right now that it's gotten a bit off track because it is trying to get you well so hard that it doesn't quite know what to do anymore. It's overwhelmed. So this is really good that your immune system is working like this, because it's working. We just need to give it a little more information so it can go in the right direction and not be like overdoing it. And so again, empowering people to know that their bodies are doing what they're supposed to do. They could just use a little guidance and better information and stuff like that. So yeah, our bodies are always doing the best they can to keep us thriving, but sometimes we just get overwhelmed. I mean, there's a lot out there to get overwhelmed by.
No kidding.
Even if it's just not just your daily life stress, but with all the environmental things there are to contend with, all the world stress. Like, there's just so much. I mean, even, cell phones, and who knows what all that radiation is doing. I don't know, not my area of expertise, but we have a lot to contend with.
Yeah. We get in the way.
Yeah.
Right? We, as like a collective society, everything, the world in 2024 has gotten in the way of our body trying to do what it's trying to do. And then, yeah, that's when crazy things happen.
And especially with women, we tend to take care of everyone else before we take care of ourselves.
Yeah.
And it just doesn't work that well. And that, when we keep neglecting ourselves, that's what we get used to. And over time, that really takes us down a lot, and not just erodes the actual physiology of what's going on, but our confidence in what we can do to stay well and feel good and have fun. And I also really think it's terrible that fun tends to be the last thing on the list of taking care of yourself a lot of the time.
Yep.
Taking care of yourself tends to be having a full-time job and eating, 3 meals a day, hopefully, but not too much because you might get fat, and drinking enough water and all of that. But like, where's the fun? Like,
going through the motions, right?
The most important part. So one of my recommendations for my clients is to schedule their fun first.
Amazing.
Because we all get so busy that if you don't schedule in the fun parts, they just don't happen. Like, you have to make time for what nurtures you. And make time is like the key there. You don't find time for that. So really important.
It changes the energy of a person as well. If you're actually getting into something you enjoy and uplifts you, and it's a totally different energy versus you're just kind of, trying to maintain things and get everything done. And it's totally different vibe.
It's very much the masculine, feminine energy side of things too, right? Like, as a society, we're very masculine energy driven, the do, and we're not taking time for the be, for the feminine side, for the receiving. And that's receiving of health, receiving of love, receiving of the things that you really want. And if we don't take time to do things, like fun is a perfect feminine energy practice. And we don't do that often enough. And you need, I don't love the word balance, but you need some balance there between the masculine and the feminine to be optimally healthy and in a good place. So very interesting.
Yeah, especially when we have just so much coming at us all the time, like especially when you get into chronic illness and stuff like that, when you have diagnosis after diagnosis and medication after medication and so much to keep track of, and you're still trying to like keep track of your career, maybe your kids, like all of those things, and can kind of forget yourself in there. So
So for all the clients you have coming to see you, where I assume a lot of them come in with a label, and you're looking to shift a lot of perspectives for them. What's the most remarkable recovery stories you have? If it's 1, 2, however, like, what have you encountered in your practice? Love to hear that.
so many.
Whatever comes to mind is probably what the audience needs to hear.
So a few years ago, I worked with this woman who had been diagnosed with hemochromatosis. Are you familiar with that one?
No, no.
Basically, when you have like too many red blood cells and they make your joints hurt and they make you itchy. And this woman especially had problems, like if she ate fatty foods, then she would get really itchy. And her joints hurt all the time. And pretty much the only treatment there is for it is giving blood often. But it was interesting in her case because, she wasn't born with hemochromatosis. It's an autoimmune disorder. And so it's like, okay, well, where did this come from? And so we were looking back through her case history, her blood work, all of that. Her blood work definitely had high iron levels. And so, that diagnosis was probably legitimate, I guess, as far as the diagnosis goes. But it didn't say anything about the why. So when we were looking through her history, she had a whole bunch of stressful stuff happen. Like she had gotten divorced and all these things. And she started taking a medication. And all this happened in 2012. And I was working with her in 2022. And I was like, so how long have you had the hemochromatosis? And she's like, oh, about 10 years. I was like, wait a minute. So you went through a divorce and started taking a medication in 2012. That was 10 years ago. Was that before these symptoms started? And it was. And so like, okay, well, so what if that's the why behind this? And so we worked through getting her health back on track. So did a little bit of work with her diet, did a lot of work with managing stress. I had her on some supplements to like get her gut healthy again, because often with autoimmune sorts of things, gut health is a key piece of that. And so I have a gut health protocol that most of my clients go through. There's always variations depending on the individual. And within 4 months, she could eat whatever she wanted. She wasn't having to give blood anymore. She didn't think she had hemochromatosis anymore. There's no like specific blood marker for that or test for that, but she didn't have the symptoms anymore. And now, like a couple years out, I still hear from her once in a while because there were a couple of supplements that she liked that I order for her whenever she wants. And so I get a report every now and then, and she's still doing great. So,
that's fantastic.
Yeah.
Life-changing is that too.
Yeah, she was having trouble keeping up with her work, and her daughter was like 20-ish at the time, and she was having a lot of problems with like gut health and chronic fatigue and all of that. And so it not only opened up her life, she could get back to work and be there for her daughter more, but she had her daughter work with me too. And I love that when the family all gets care. And her daughter was like dropping out of college, kind of fatigue and sick. So she worked with me and was able to finish college. I believe she just graduated or is about to now. So
Amazing. What are some initial steps someone with chronic or unsolved symptoms, as you call them, they can take to start working towards their own better health?
schedule the fun first.
Amazing.
Good advice.
It's really important to take some time every day, even if it's only 5 or 10 minutes, to recognize how amazing you are and start building that confidence that you can get healthy, that you've solved so many of your health problems already, even if it's just, that cut on your finger, like you mentioned before. Just thinking about all of that, because it can be a lot of people that are chronically ill need a big mindset shift. And that's a place to start. So for something to do on their own, like that, I think is the most important, to build up their belief system that they can heal. Yeah, that's my favorite one.
Totally agree with that. It's huge.
Yeah, mindset's a huge component of it. Are you able to share a personal habit or daily practice that's been crucial for you managing your own health?
Well, I do schedule in my fun. I've been skiing all morning.
Oh, lovely.
Yeah. I'm actually watching people ski now. I'm sitting at the bottom of the trail and I have ski boots on. So, and I put skiing on my schedule every week for as long as the season will last. And even if I don't necessarily feel like going that day, I go anyway because I know I'm going to feel better afterward. And I scheduled it in. like today, the weather's not as great as I wanted it to be for spring skiing and all that. So I was a little bit on the fence, but I was like, oh wait, it's on my schedule. And I saw it come up on my schedule. It's like, it's there. I have to do it.
I think that's a big thing because sometimes we can schedule things in. It's like, oh, I don't have to do that. I can do something else. But you're actually committing to yourself and
Yeah.
building the habit of this is here, let's do it. And you said yourself, I know how good I'm going to feel after I do it.
Yeah. So definitely making that commitment to be really good to yourself, to be really kind to yourself, and figure out what makes you feel the best. Because I know so many people, including myself, that when they're doing something fun, they don't notice their symptoms or their disease, if they want to call it that, or their whatever their diagnosis is. They don't feel it anymore once they get out and do something that they love. And that's your mind at work. And to me, that's amazing, because that means that you can grow that feeling. You can grow that feeling of just feeling great because you're in your zone, because you're feeling good, because you're doing something really good for yourself. So that's a huge piece.
Yeah, that's big as far as where you focus your attention, that'll grow. That's pretty much kind of the thinking.
Yeah. Amazing. Well, you've shared some incredible information today, and I know that our listeners will thoroughly enjoy this episode. If someone wants to get in contact with you, what's the best way that they can do that?
Probably the best is to go to my web, it's drelizabethdavidson.com. And if they go to my blog page, there's a couple freebies in there that they can click on and get a little education on intuition and stuff. And they're short little videos. But there's also I update my blog fairly often with my thoughts on health. So it's a great place to read stuff. There is a button on there where they can get a free call with me too.
Amazing.
Perfect. Is there one key message or takeaway you'd like to leave the listeners with?
You're all amazing healers, and trust yourself. I guess trust yourself. Like if you feel something is right, or if you feel it's wrong, trust that, because don't overthink it. Like just trust that. And I love that. Do you know who said that? Like if you think you can, or if you think you can't, you're right.
Henry Ford.
I don't know who
Yes,
said
exactly.
Henry Ford.
Okay, thank you. But it's one that I think about a lot. I'm raising a teenager lots of times. Like, I can't. Like, okay. Well, let's have a discussion here then. So yeah, really just trust yourself and question things. Like, lots of people, they're going, when they feel sick, when they have chronic symptoms, they do go through the medical model, and that's okay. But if the doctor says something that you don't like, that you don't agree with, or that you don't understand, ask for more information, and don't just do what that doctor says. If it doesn't feel right to you, the diagnosis or the medication or whatever the treatment is, if it doesn't feel right to you, trust that, because that's your body knowing. So get another opinion, ask lots of questions. I'm really good at giving other opinions. So get in touch, but don't just do what someone says because you feel like they're more powerful or something, because you have all the wisdom you need right in your body, and trust yourself.
Yeah, this is just like how we mentioned before, when you get that gut feeling and you don't listen, how does it go?
It doesn't go well.
Right into that.
But, we tend to, when we're put in front of someone who in power, like a medical doctor or someone, we tend to throw our gut feelings out the window because they know best, but they don't. Most of them spend 10 minutes a year with you. Like, how would they know? So you know best, trust that. And it's not like you have to be rude to them or anything, but ask a lot of questions. And if they don't want to help you figure it out, like if they don't want to answer your questions or explore further or help you get another opinion, or a big one is helping people get off of medications. Like a lot of my clients get off their medications, and a lot of their MDs don't want to help them with that. Like, okay, well then it's time to find a different doctor, because if you want to get off a medication, you should have all the support that you need.
Amazing. Well, thank you so much again. That was such great advice for people too, and it's things that we often don't even think about. And I mean, where did the belief come from? Also, when it comes to trusting the medical doctors, that was a question I had to ask myself too. It's like, this is my
Mhm.
belief that the doctor knows right. You never question them. Where did that come
Mhm.
from? It wasn't mine. I inherited
No.
it.
Yeah.
Or it came from other members of society that told me this is the way that things should be. And
Mhm.
ignoring your intuition, we've mentioned that a couple times in this episode, it doesn't go well. So yeah, I
No, it
love
never
that.
does.
Love that. Well, thank you again for joining us today. I hope everyone really enjoyed this episode. The information to connect with Elizabeth will be in the show notes as well. And we will see you all on the next episode.